What is the position of the brachialis muscle relative to the biceps brachii? Deep, medial, superficial, or lateral? Deep. The brachialis is the primary flexor of the elbow and lies deep to the biceps brachii, originating from the anterior surface of the humerus. How is the femoral nerve positioned relative to the femoral artery? Medial, posterior, anterior, or lateral? Lateral. Within the femoral triangle, anatomical structures are arranged in a specific lateral to medial order. This order is remembered with the mnemonic navel: nerve, artery, vein, empty space, lymphatics. This arrangement is a crucial landmark for clinical procedures like femoral artery access. What is the relationship between the vastus medialis and vastus lateralis? Medial, posterior, anterior, or lateral? Medial. Vastus medialis forms the teardrop-shaped muscle on the medial thigh, crucial for patellar tracking, while vastus lateralis is the large lateral component of the quadriceps. How is the spleen positioned relative to the left kidney? Superior, lateral, medial, or anterior? Anterior. The spleen is a lymphoid organ in the left upper quadrant. It lies anterolateral to the left kidney, separated by the splenorenal ligament, and is protected by ribs 9 to 11. What is the position of the common bile duct relative to the portal vein? Medial, posterior, anterior, or lateral? Anterior. The classic arrangement of the portal triad and the hepatoduodenal ligament can be recalled with the mnemonic CBD, hepatic, portal. From anterior right to anterior left to posterior, this corresponds to the common bile duct, hepatic artery proper, and portal vein. How are the flexor tendons positioned relative to the carpal tunnel? Medial, lateral, superficial, or deep? Deep. The carpal tunnel is a narrow passage. The flexor tendons and the median nerve pass deep within it, beneath the flexor retinaculum. Compression causes carpal tunnel syndrome. What is the relationship between the diaphragm and inferior vena cava? Anterior, inferior, posterior, or superior? Superior. The IVC returns blood to the heart by passing through the caval opening in the central tendon of the diaphragm at vertebral level T8. As a result, the thoracic surface of the diaphragm is superior to the abdominal IVC. How is the sigmoid colon positioned relative to the rectum? Posterior, anterior, superior, or inferior? Superior. The sigmoid colon is the S-shaped terminal part of the colon. It lies superior to the rectum, ending at the rectosigmoid junction, where it becomes the rectum. What is the position of the brachioradialis relative to the pronator teres? Superficial, deep, medial, or lateral? Lateral. The brachioradialis is a flexor of the elbow that forms the lateral border of the cubital fossa, lying lateral to the pronator teres, which forms the medial border. How are the intercostal muscles positioned relative to the ribs? Lateral, medial, superficial, or deep? Deep. 3 layers of intercostal muscles fill the spaces between ribs. They lie deep to the skin, subcutaneous tissue, and often the serratus anterior or latissimus dorsi, but superficial to the pleura. How is the ulnar nerve positioned relative to the medial epicondyle? Posterior, anterior, superior, or inferior? Posterior. The ulnar nerve passes posterior to the medial epicondyle of the humerus in a groove. This superficial location makes it vulnerable to trauma, causing the sensation of hitting the funny bone. What is the position of the prostate gland relative to the urinary bladder? Superior, posterior, inferior, or anterior? Inferior. The prostate gland surrounds the prostatic urethra. It is situated directly inferior to the neck of the urinary bladder. An enlarged prostate can therefore obstruct urine flow from the bladder. How are the palmar interossei muscles positioned relative to the dorsal interossei? Distal, palmar, dorsal, or proximal? Palmar. There are 3 palmar interossei and 4 dorsal interossei. They are named for their position, not their action. What is the relationship between the cerebellum and cerebrum? Anterior, posterior, superior, or inferior? Posterior. The cerebellum coordinates movement and balance. It is located in the posterior cranial fossa, separated from the overlying cerebral hemispheres by the tentorium cerebelli. How is the tibialis anterior positioned relative to the extensor digitorum longus? Lateral, medial, deep, or superficial? Medial. In the anterior compartment of the leg, the tibialis anterior is the most medial muscle. The extensor digitorum longus lies immediately lateral to it. What is the position of the aortic arch relative to the trachea? Superior, posterior, anterior, or inferior? Anterior. The aortic arch ascends, arches anterior to the trachea, and then descends posteriorly. This anterior relationship is key in mediastinal anatomy and thoracic surgery. How are the vocal cords positioned relative to the vestibular folds? Inferior, lateral, superior, or medial? Inferior. Within the larynx, the true vocal cords are the inferior pair responsible for sound production. The false vocal cords are the superior pair that primarily protect the airway. What is the relationship between the radius and scaphoid bone? Proximal, distal, anterior, or posterior? Proximal. The radius is one of the two forearm bones. At the wrist, it articulates with the scaphoid. Along the limb's axis, the radius is proximal to the carpal scaphoid bone. How is the gastrocnemius positioned relative to the soleus? Lateral, medial, superficial, or deep? Superficial. The gastrocnemius is the large, two-headed calf muscle that gives the calf its shape. It lies superficial to the soleus. Together, they form the triceps surae and share the Achilles tendon. What is the position of the hyoid bone relative to the thyroid cartilage? Anterior, superior, inferior, or posterior? Superior. The hyoid bone is a U-shaped bone in the anterior neck. It is located superior to the thyroid cartilage. It is a key attachment point for tongue and swallowing muscles. How are the atria positioned relative to the ventricles? Anterior, posterior, superior, or inferior? Superior. In the anatomical position, the heart's receiving chambers are situated superior to the larger, more muscular pumping chambers. Blood flows from atria down into ventricles. What is the relationship between the pulmonary artery and pulmonary vein? Inferior, posterior, superior, or anterior? Anterior. At the lung hilum, the pulmonary artery carries deoxygenated blood from the heart. It is typically positioned anterior and superior to the pulmonary veins, which carry oxygenated blood back to the heart. How is the fibularis longus positioned relative to the fibularis brevis? Deep, posterior, anterior, or superficial? Superficial. In the lateral compartment of the leg, the fibularis longus is the more superficial muscle, overlying the fibularis brevis. Both muscles avert the foot and are innervated by the superficial fibular nerve. What is the position of the mastoid process relative to the external auditory meatus? Anterior, posterior, inferior, or superior? Posterior. The mastoid process is a prominent bony projection of the temporal bone. It is located posterior and slightly inferior to the external acoustic meatus. It contains air cells and is an attachment for neck muscles. How are the metacarpal bones positioned relative to the carpal bones? Distal, proximal, palmar, or dorsal? Distal. The 5 metacarpal bones form the skeleton of the palm. They are distal to the 8 carpal bones of the wrist and proximal to the phalanx of the fingers. This forms the longitudinal arches of the hand. What is the relationship between the nasopharynx and oropharynx? Posterior, anterior, inferior, or superior? Superior. The pharynx is divided. The nasopharynx is behind the nasal cavity. The oropharynx is behind the oral cavity. Thus, the nasopharynx is superior. How is the deltoid muscle positioned relative to the shoulder joint? Medial, lateral, superficial, or deep? Superficial. The deltoid is the thick triangular muscle that forms the rounded contour of the shoulder. It is the most superficial muscle, lying directly over the glenohumeral joint capsule and the rotator cuff tendons beneath. What is the position of the jejunum relative to the ilium? Anterior, distal, proximal or posterior. Proximal. The jejunum is the second part of the small intestine, beginning at the duodenojejunal flexor. It is proximal to the ileum. The jejunum has thicker walls and more vascular arcades compared to the distal ileum. How are the plantar muscles positioned relative to the plantar aponeurosis? Superficial, medial, deep, or lateral? Deep. The plantar aponeurosis is a thick fibrous band on the sole of the foot. All the intrinsic plantar muscles lie deep to this aponeurosis, which supports the longitudinal arch. What is the relationship between the clavicle and first rib? Anterior, superior, posterior, or inferior? Superior. The clavicle acts as a strut for the shoulder. It lies superior to the first rib. The neurovascular structures to the arm pass between them. How is the trapezius muscle positioned relative to the rhomboids? Medial, lateral, deep, or superficial? Superficial. The trapezius is a large, superficial muscle of the upper back and neck. The rhomboid major and minor muscles lie deep to the middle fibers of the trapezius. What is the position of the optic chiasm relative to the pituitary gland? Superior, anterior, inferior, or posterior? Superior. The optic chiasm is where the optic nerves partially cross. It sits in the suprasellar cistern, directly superior to the pituitary gland. Pituitary tumors can compress it, causing bitemporal hemianopia. How are the lumbar vertebrae positioned relative to the sacrum? Inferior, superior, anterior, or posterior? Superior. The 5 lumbar vertebrae form the lower spine with a pronounced lordotic curve. They are positioned directly superior to the sacrum, with the L5 vertebra articulating with the sacrum at the lumbosacral joint. What is the relationship between the epidural space and dura mater? Deep, medial, lateral, or superficial? Superficial. The epidural space is a potential space outside the dura mater, the tough, outermost meningeal layer. It contains fat and venous plexuses and is the target for epidural anesthesia. How is the pectoralis minor positioned relative to the pectoralis major? Medial, deep, lateral, or superficial? Deep. The pectoralis major is the large, superficial chest muscle. The pectoralis minor is a smaller, triangular muscle that lies deep to it, originating from ribs 3 to 5 and inserting on the coracoid process of the scapula. What is the position of the talus relative to the calcaneus? Inferior, superior, posterior, or anterior? Superior. The talus is the keystone of the foot. It articulates with the tibia and fibula above and sits directly superior to the calcaneus, transmitting body weight to the ground. How are the interventricular septum positioned relative to the right ventricle? Anterior, posterior, lateral, or medial? Medial. The interventricular septum is the wall that separates the two ventricles. It forms the medial wall of the right ventricle. A defect here allows blood to shunt from the high-pressure left ventricle to the right. What is the relationship between the saphenous vein and femoral artery? Superficial, medial, deep, or lateral? Medial. The great saphenous vein is the longest superficial vein of the leg. In the femoral triangle, it is located medial and superficial to the femoral artery, which lies deeper within the femoral sheath. How is the gluteus medius positioned relative to the gluteus minimus? Superficial, anterior, posterior, or deep? Superficial. The gluteus medius is a major hip abductor. It lies superficial to the smaller gluteus minimus. Both are crucial for stabilizing the pelvis during walking. Weakness causes a Trendelenburg gait. How are the coronary arteries positioned relative to the epicardium? Lateral, medial, deep, or superficial? Deep. The coronary arteries supply blood to the heart muscle. They run on the surface of the heart within the epicardial fat, which means they are deep to the visceral layer of the serous pericardium. What is the relationship between the basilic vein and brachial artery? Medial, lateral, superficial, or deep? Medial. The basilic vein is a major superficial vein of the upper limb. In the arm, it ascends along the medial side and is superficial. The brachial artery runs deeper and more lateral in the medial bicipital groove. How is the vastus intermedius positioned relative to the rectus femoris? Medial, lateral, deep, or superficial? Deep. The rectus femoris is the most superficial muscle of the quadriceps group. The vastus intermedius lies deep to it, directly on the anterior surface of the femur. Both contribute to the quadriceps tendon. What is the position of the ischium relative to the ilium? Anterior, superior, inferior, or posterior? Inferior. The hip bone has three parts. The ilium is the large, superior wing-like portion. The ischium is the inferior, L-shaped part that includes the weight-bearing ischial tuberosity. How are the olfactory bulbs positioned relative to the cribriform plate? Posterior, superior, inferior, or anterior? Superior. The olfactory bulbs are extensions of the brain that process smell. They rest superior to the cribriform plate of the ethmoid bone. Olfactory nerve filaments pass through holes in this plate to reach the bulbs. What is the relationship between the transverse colon and small intestine? Inferior, superior, anterior, or posterior? Superior. The transverse colon is the longest and most mobile part of the colon. It crosses the upper abdomen, suspended by the transverse mesocolon, and lies superior to the coils of the jejunum and ilium. How is the pronator quadratus positioned relative to the flexor tendons? Superficial, proximal, distal, or deep? Deep. The pronator quadratus is a flat, square muscle in the distal forearm. It is the deepest muscle of the anterior compartment, lying directly on the interosseous membrane, deep to the long flexor tendons. What is the position of the manubrium relative to the body of the sternum? Anterior, inferior, superior, or posterior? Superior. The sternum has three parts. The manubrium is the broad, superior portion that articulates with the clavicles. It lies superior to the body of the sternum, forming the sternal angle at their junction. How are the semicircular canals positioned relative to the cochlea? Superior, inferior, anterior, or posterior? Posterior. In the inner ear's bony labyrinth, the three semicircular canals are oriented posterior and superior to the snail-shaped cochlea. What is the relationship between the inguinal ligament and femoral vessels? Inferior, anterior, superior, or posterior? Superior. The inguinal ligament is the rolled under inferior edge of the external oblique aponeurosis. It forms the superior border of the femoral triangle. The femoral artery and vein pass inferior to it to enter the thigh. How is the serratus anterior positioned relative to the scapula? Posterior, inferior, anterior, or superior? Anterior. The serratus anterior is a fan-shaped muscle on the lateral rib cage. It lies on the anterior surface of the scapula, between the scapula and the ribs, and is crucial for scapular protraction and rotation.